So today we'll be discussing very interesting MRI feature, that is MRV, that is venogram, MRI venogram versus MR angiography, that is MR magnetic resonance angiography. So in angiography, what we see is all the major blood vessels supplying to the brain. This is MR angiography and this is MR venography, because here we are seeing veins. So in short, what I'll tell you, this is MR angiography of the brain. Now what we see is this is arch of aorta. This is arch of aorta. From here, from this heart, this arch of aorta is originating. Now for the first branch of arch of aorta is this brachiocephalic trunk. So this is brachiocephalic trunk, and we know on the right side this brachiocephalic trunks gives two branches. One is common carotid artery and one is subclavian artery. So this is right subclavian artery and this is common carotid artery, and this common carotid artery then gives this ICA, that is internal carotid artery, and this ECA, that is external carotid artery, and this right subclavian artery gives the branch which is right vertebral artery. This is right vertebral artery. So this is arch of aorta with brachiocephalic trunk and giving these branches which I told just now. Now after this brachiocephalic trunk, the second branch which arises, it is common carotid artery. So this is common carotid artery. So common carotid artery, left cam CCA, is direct branch of arch of aorta, and then it goes up and it divides then into uh, internal carotid artery, which is going medially, and external carotid artery, which goes outside external carotid artery. And the third branch of arch of aorta is the subclavian artery. So this is subclavian artery. And this subclavian artery basically gives the vertebral artery. So left-sided vertebral artery is a branch of left subclavian artery, which is a branch of basically direct arch of aorta. So after this, we know that these branches are coming towards brain, towards the skull, and here I'll be telling in short about the branches which form the circle of Willis. So we know this is very typical. These are the two vertebral arteries. This is left vertebral artery. This is right vertebral artery, and these two arteries join and form basilar artery. So this is basilar artery. This is basilar artery, which is single, which lies just in front of pons, in the middle of the pons. Just it lies in front of middle of the pons, and this basilar artery then divides into two, giving two posterior cerebral arteries. So this is left PCA, this is right PCA. So this is right posterior cerebral artery, this is left posterior cerebral artery. Now, apart from that, what we need to know is this. I just told that this is internal carotid artery. This is ICA, which is coming up, and here what we can very nicely make out is this is MCA. This is MCA. So this is left MCA. This is right MCA. That is middle cerebral artery, and the last artery which is remaining is anterior cerebral artery. So this is ACA. So this is right ACA, anterior cerebral artery. This is left anterior cerebral artery, and these are the branches which actually communicate the two anterior cerebral artery. We call it as anterior communicating arteries. So overall, these are the all arteries which we can very nicely see in this angiography. This can be very well evaluated in other films as well. I won't be going into detail of these arteries. Now this is venogram. Why this is important? This in this we what we see is we see all the major cortical veins. So this in the center, the largest one is superior sagittal sinus. This is superior sagittal sinus. So this is the central vein in the middle. That is the reason why it is called superior, and it is in the middle, so it is called superior sagittal sinus. This is same vein, that is superior sagittal sinus, and this is in this shape. So this is superior sagittal sinus. This is superior sagittal sinus. This is also superior sagittal sinus. So you can trace it all from frontal up to the occipital cortex. So this is superior sagittal sinus. The same way we have inferior sagittal sinus. So we can trace this. This is inferior sagittal sinus. We can also trace this in this area, like here. So this is inferior sagittal sinus because this is just below the superior sagittal sinus. You can directly make out, and it is in the same direction. Now this straight vein which we can see this here is what we call it as straight sinus, because this is more of a straight vein. So this is very typical of straight sinus. We can make it here as well, here as well. So this is straight sinus. Apart from that, what other structures we can see is, uh, I'll show you the other structures as well. This just in front of this superior sagittal sinus, whatever structure which is going in front of this straight sinus is what we call it as vein of Galen. This is, we call it as vein of Galen, and this vein of Galen uh, can be traced continuously anteriorly as internal cerebral vein. So this structure or this vein is internal cerebral vein. This or this. This is internal cerebral vein. This is vein of Galen. This is straight sinus. Straight sinus. So these are very important landmarks whenever we want to see venogram. Other structures which we can see, basically, I'll show you other things as well. Apart from these veins, the most important structure which we can very nicely make out in this film is, we know this is superior sagittal sinus. Now the this transverse vein, which actually is continuing from the superior sagittal sinus, is transverse. That is the reason why it is called transverse sinus. This is transverse sinus because it is transverse. Next thing is, this transverse sinus continues as a sigmoid or S-shaped sinus. So we call it as sigmoid sinus. We can make out it here as well. So this is sigmoid because this is S-shaped. So we label it as sigmoid sinus. We can trace this here also. So this is S-shaped. So this is sigmoid sinus. So we can trace it here as well. So this is all sigmoid sinus, and this sigmoid sinus then continues as internal jugular vein. So this is called internal jugular vein because the sigmoid sinus then continued as internal jugular vein. So these internal jugular and external jugular veins, they join and they form then brachiocephalic trunk, and this right and left brachiocephalic trunks, they join and they form superior vena cava. So in this film we can very nicely appreciate, I'll show you, that this sinus is only apparent on the right side. So we can see it here. It should be present on this side as well, this side as well, this side as well, but it is not there. So in short, in this film, left transverse is missing, left sigmoid is missing, and left IG is not very much prominent. So it can be because of only two things. Either these veins are hypoplastic, very small in caliber, that is the reason they are not visible, or there is clot in it. It's very simple to understand. If this patient has clot, it means the patient has VST, that is cortical venous sinus thrombosis. Patient should definitely compulsorily have headache or convulsion, which is extremely common. So if patient is presenting with headache, convulsions, if patient MRI shows infarct as well, then definitely the chances are much more that it is thrombosed. That particular vein or sinus is thrombosed. If there is no infarct, if the patient has no symptom, uh, if this MRI is done for some other reason, then definitely it looks more of a hypoplastic. But if it is thrombosed, then the T1, then DWI, ADC imaging will definitely show infarct, and patient will definitely have headache, convulsions, or typical infarct. So this was all about this MR venogram and angiogram for today. Thank you.